Hi everyone, my name is Alicia Hack and this is my PDSA Quality Management Project presentation for Nursing 451. Issue identification. The issue I identified for this project at my place of work is the lack of a well-developed new hire nursing orientation program that properly prepares nurses to provide bedside patient care. The current orientation program provides limited education on organizational and practice protocols, minimal training on electronic medical records, and lacks structure and consistency. This has led to high turnover rates and elevated anxiety levels, as nurses have stated they do not feel ready to be providing care on their own. The current SNF orientation program meets the California Department of Public Health minimum standards for training. This includes training on problems and needs of the aged, chronically ill, acutely ill, and disabled patients, prevention and control of infections, interpersonal relationships and communication skills, fire prevention and safety, accident prevention and safety measures, confidentiality of patient information, preservation of patient dignity, including provision for privacy, patient right and civil rights, signs and symptoms of cardiopulmonary distress, choking prevention and intervention, and training in cardiopulmonary resuscitation. CDPH 2017. A successful nursing orientation program should take into account the organization, the nurses, and the needs of the nurses. The orientation program should be integrated into the overall organizational strategy, Kiel 2012. It should also help to retain and motivate employees, decrease turnover, increase productivity, improve staff morale, facilitate learning, and reduce anxiety of new employees. Ragsdale and Mueller, 2005. Quality variance. According to the company and management, 5 total days spent on training on policies and procedures and how to use the electronic charting system, in addition to 5 days spent orienting and precepting on the floor, should be sufficient enough to prepare a newly hired nurse to start bedside patient care on their own. The reality is that the 5 days spent in the classroom is a quick one-time overview of policies and procedures and a general introduction into the electronic charting system. New hires then must orient to the floor and precept on each station and each shift within another 5 days. Preceptorship for new hires is usually with multiple nurses, which can lead to variations in how care is performed. Also, there have been occasions where fairly new nurses are precepting new hires when they do not yet have the experience, skill set, and competence to do so. New hires have a competency checklist they must complete prior to providing patient care on their own. However, they are often allowed to start on their own without the checklist being completed. There have also been instances where new hires are asked to work on the floor on their own before the 5 days of precepting is complete due to severe staffing shortages. Root cause analysis. A root cause analysis was performed to determine why there is a high turnover rate for nurses at this SNF. The problem identified was the high turnover rate for nurses. The problem is caused by new hires feeling overwhelmed and underprepared when they start patient bedside care on their own. And this is due to insufficient time spent on orientation both in the classroom and during preceptorship. Scope of the problem. The high turnover rate impacts patients, current nurses, and the company. Patients suffer from frequent changes in nursing staff, resulting in unfamiliarity with nurses and routine and decreased continuity of care. Current nurses suffer due to continued shortages, heavy workloads, and frequently having to preceptor new hires. The company loses a significant amount of money spent on orientation and training when new hires quit shortly after training is complete. Solution. The solution I have identified to increase retention and decrease nurse turnover is to overhaul and change the new hire orientation program. This can be done in several ways. First is to incorporate a simplified simulation into classroom training. Utilizing simulation can result in gained knowledge, increased skill competence, increased learner satisfaction, and improved critical thinking. Murphy and Janice, 2017. The orientation program should be regularly updated to include most recent evidence-based practice and new or modified policies and procedures. Sims and Bodner, 2012. Management should also designate several preceptors for every shift. Preceptorship can increase program satisfaction, promote retention, and reduce turnover and cost. Sandow and Halm, 2010. Finally, the new orientation program should increase duration of training to 1 additional day of classroom orientation and 2 additional days of floor orientation and preceptorship. Improvement goal. The improvement goal is to increase retention and decrease turnover rates within a 6-month period. Solution implementation. The first step to solution implementation is to increase the duration of new hire training. Classroom training should be increased from 5 days to 6 days. The first 2 days should be spent on reviewing company policies and procedures and discussing how to apply the most recent evidence-based practice when providing care for the current patient population. The next 3 days should be spent on teaching the electronic charting system. This should include training on how to complete a full admission, a full discharge, Medicare and HMO charting, patient change in condition charting, and how to document in the EMR. Once new hires have been walked through the electronic charting system, they should be provided with scenarios for each of the above areas and demonstrate how they would document the information in the system. The final day should be spent on simulation. This will not be a true simulation training, as there are no available simulation labs to the SNF and they cannot afford the cost to send new hires to simulation training. However, a very simplified simulation training can be provided by running through scenarios and having new hires act as the charge nurse for each situation. The following scenarios should be discussed. Code blue, hypoglycemic episode, a patient experiencing chest pain, a patient experiencing shortness of breath, a patient fall, medication error, abnormal lab results, and abuse allegations. New hires should use their previous training and/or experience, reflect on the company policies and procedures, and utilize evidence-based practice when discussing how they would handle each scenario. After each scenario is discussed, the classroom educator can address what the new hire did well, if anything was missed, and what other alternatives are available. Floor orientation and preceptorship should be increased from 5 days to 7 days. The first day should be spent orienting new hires to the floor, such as where supplies and equipment are located, how to use the phone and fax system, how to find contact information for physicians, laboratory, pharmacy, and portable imaging, and where medications are located and how to pull them. During the first day, new hires should also shadow their preceptor to help them understand the general flow of the shift. On days 2 through 4, new hires should work with their preceptor, start completing skills on their competency checklist, and begin documenting in the electronic charting system and EMR. They should also start passing medications to several patients under supervision. On days 5 through 7, new hires should complete 1 admission, 1 discharge, and 1 full medication pass under supervision of their preceptor. Under this new orientation program, new hires will not be allowed to provide patient care on their own until the 7 days of training is finished and they have completed at least 1 admission, 1 discharge, and 1 full medication pass. They must also have completed the majority of items on their competency checklist. It is understood that they may not have the opportunity to perform all skills on the checklist during training. When this is the case, the new hires must be informed that if a situation arises to perform a skill not previously done during training, then the new hires should be supervised during the skill to be cleared for further performance of the skill on their own. Additionally, at the end of training on day 7, new hires should be asked if they feel comfortable enough to start patient care on their own or if they would like an additional day of training. The next step of the solution implementation is to designate several preceptors on every shift. Preceptors should be experienced nurses who are confident and competent in their skill set and consider leaders to other nurses on the floor. As much as possible, new hires should complete their training with the same preceptor throughout training to prevent confusion on expectations and variations in care. Finally, the new hire orientation program should be reviewed every quarter and updated as needed to reflect new and changing policies and procedures and to incorporate the most current and relevant evidence-based practice into training. This will allow for safe and high quality care to be provided to patients. The new orientation program will require the participation of the current nursing staff and the company management team. The nursing staff will be walked through the new hire orientation process. Potential nurse preceptors will be identified from each shift. Management will individually discuss the role of preceptorship with each of these nurses to determine who is willing to participate. Nurses who choose to preceptor must be aware that it will impact their workflow and likely slow them down to some extent. Management must afford more time to the designated classroom orientation educator. This is to ensure that the orientation program is regularly kept up to date and that simulation scenarios are relevant to the current population. Additionally, the company will have to approve an additional 3 to 4 days of paid training for new hires for this program to be fully implemented. Solution implementation timeline. I expect that it would take roughly 1 month for the company to review the proposed new hire orientation program, discuss how effective it could be, and decide whether or not to implement it. If the company chooses to implement the program, I would anticipate another 1 to 2 months spent on the complete overhaul and update to the orientation program that will fit the solutions I have proposed. Analysis. To determine if the solution is meeting the goals on increased retention and decreased turnover, I will use both surveys and data collection. A survey will be given to new hires on the last day of preceptorship to determine what they like about orientation and what they think they would have liked to have more training on in both classroom orientation and preceptorship. Follow-up surveys will also be given at 1 month and then 6 months. This will give the new hires time to reflect on their experiences and provide suggestions to management on how to update or change certain aspects of orientation. Surveys will be anonymous to allow new hires to submit their feedback without any concerns. Once the new orientation program is implemented, data should be collected on how many new hires continue to work for the company after completing orientation and for how long. This data should be compared to the previous years to determine if there is increased retention in nursing staff. Next steps. Management and the orientation educator will utilize the survey results and data collection to update the new hire orientation program to reflect the needs of the nurses. A continuously updated orientation program that is reflective of nursing needs is the most effective way to increase retention rates. If retention rates do not change over a 6-month period, the company should look to other similar companies with higher retention rates to determine what could be done differently. And this is my reference list. Thank you for watching my presentation.